This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle, live in studio, waiting to take your phone calls on any aspect of healthcare that you'd like to talk about. Perhaps you've had a problem, you've tried, you've applied. Here's an opportunity. Let's figure out something that actually works instead of the same old that you've been doing for so long. 888-630-9625. That's 888-630-9625. Love to talk to you. Have a couple things to share with you today, and I hope you'll call soon because, everybody waits to the end of the program. So let's talk early on and let's see what we can do about all those things that have been bugging you for so way, way too long. Last month was a combination of celebrations for acupuncture and chiropractic care and basically conservative approaches to health care. And, a lot of my patients will come in and say, you talk about nutrition, you talk about all these things, but you never talk about, your first love, the thing that you do, that you've been doing for 38 years. And, most of you know, if you listen to the program, if you go to the website, that my first credentialing was that as a chiropractor. Then I ended up with a license in acupuncture. Then I ended up with 2 diplomate specialties in functional human nutrition. And so, all the nonsense. Anyway, it's just alphabet soup that goes after the name. Meanwhile, they ask, why don't you talk about the effectiveness of manual manipulation? When you talk about manual manipulation, we're talking about manual manipulation of the spinal column and of the associated structures, the extremities and the skull and, the hands and the ankles and so forth and so on. And why is that so important? Well, follow me through with this for a second. Visualize your body. You're standing there looking at yourself in the mirror, and you got all the skin and muscles and eyes are looking at you, your lips are flapping, and, your skin has a certain coloration. By the way, all those things are really important diagnostically. But more importantly, where does it start? Well, you have a brain and you have a spinal cord. You have 31 pairs of nerves that come off the spinal cord. You have 12 cranial nerves. And then you have all of the small little branches off of that. So that is your electrical system. That's what makes your body actually work. That's what makes you digest. That's what makes your immune system kick in. That's what makes you able to hear and see and taste and smell and so forth, because those are all cranial nerve functions and they're automatic. You do those things without thinking. The thing of it is that we get in trouble, and sometimes those mechanisms don't work the way they're supposed to, and you have an above-down problem. What do I mean like that? The brain, the spinal cord, is not communicating the way it should to the rest of the body. So when we look at dysfunction, if you will, dis-ease, disease, disharmony, we have to ask the question, why? Where did it come from? Well, we are negligent if we don't look at the primary underlying situation first, nervous system. And when patients come into my office, we look at neurological function and its manifestation, its representation of what's in front of us, because it gives clues. It tells us what's going on in the body. It's like looking at your computer screen. There's an electrical source to that computer screen. You pull the plug on the wall, your computer doesn't work anymore. You pull the plug on you, you don't work anymore. Or if you dampen that flow electrically, your body is not going to portray itself optimally the way it should. So let's talk about a couple different fields. There's 2 areas that in our modern society that has embraced and utilized manual manipulation. Chiropractic is the one that everybody thinks about first, but also osteopathic medicine, which was started by Andrew Taylor Still. Chiropractic field was started by a guy by the name of D.D. Palmer back in 1895. And subsequently, a system of treatment and healing came about. But we're going to take about one piece of that, and we're going to talk about pain. So you have these nerves that come out, and they go to different targets. Well, nerves have functional capacity, they have sensory capacity, and they have pain interpretation. And if you stretch a nerve, if you pinch a nerve, if you irritate the joint space, your spinal joints, your spinal vertebral areas, the vertebrae, the bones of your back, in a way that causes those neurological signals to be aberrated in some way. You can end up with something called pain, loss of function, dysfunction, and so forth. There was a study many years ago at the University of Colorado by a researcher, PhD type of guy by the name of Su, S-U-H. And Dr. Su was funded by, above all else, the American Medical Association, and to show the efficacy of the concept that chiropractic portrayed for many years called spinal subluxation. Subluxation simply means that a bone in your spine or one of the cranial bones or whatever are out of place in a way that is causing irritation but causing dysfunction to the body. Well, obviously, funded by the AMA, this study was not meant to support chiropractic, but in fact it was supposed to debunk it. It was supposed to say, this stuff is garbage, it doesn't work. So what they did is they took laboratory animals, they took little rats and they took guinea pigs and so forth, and they surgically subluxated the spines. They moved the vertebrae out of position just millimetrically, just a little bit. And then they monitored the end product, what happened symptomologically to these animals, to these rats, right? Well, here's what the end result was. In every case, when they subluxated the spine millimetrically, just a little bit, it caused enough neurological dysfunction to cause extraordinary pain in some cases, loss of physiological function to where that nerve went. Because remember, the nerves go to the organ systems and to the muscles. And what they found, their conclusion was that the weight of 2/4 was enough irritation to the spinal nerve root to cause those symptom manifestations, the weight of 2/4. Now you say, where is that documentation? Where is that research now? Well, you can look it up. Go and look up at SU, University of Colorado. It goes back a whole lot of years. But you know why it became mainstream? Because it didn't do what they wanted to do. It didn't debunk the process of spinal subluxation. It actually supported it significantly. So when you look at and you do research that, what are one of the main things? There's a lot of things you're going to see and they're going to sidestep, but you have to ask the question, who paid for the study? What were they trying to accomplish? And ultimately, what was the outcome, right? So what I want to talk to you about today is a little bit is really how that structural system works. But we're going to talk about nutrition, and we're going to talk about all the things that we normally do. But I really would like you to understand that this manual manipulation of the spine is a super, super safe, extraordinarily effective method of treating pain that starts in the spinal system. And now what you also have to remember is anything that is internal, because you've screwed up dietarily, you're stressing like crazy, is ultimately going to affect the structural system as well. So non-surgical treatment of disorders of the nervous system and the skeletal system are very specific. And by the way, the effect to our economy for these types of things is number one cause of disability. Number one cause of disability is back pain. And it's a cost to our society, to you, of $50 billion a year, direct and indirect costs. So this is, significant. This is not something to be poo-pooed, but $50 billion and rising. Every year things get more expensive, right? We want to know how to deal with the rising cost of healthcare. Well, there's a lot of ways of getting this done. There are a lot of studies out there that have concluded significantly that manual manipulation used by chiropractors are generally the most effective treatment for lower back pain, as well as, by the way, slip disc, herniated disc, and by the way, radiculopathy. That means pain down into an extremity in your arms and your legs and so forth, and neck pain and other associated situations like that. So, what happens? What does a chiropractor do? What does an osteopath do when they put their hands on your spine? They're using sometimes low force, sometimes instrumentation, sometimes other things that will allow that spinal system to balance. And you need to know what it's all about. Spinal manipulation refers to, in many situations, short lever, means arm thrusting, high velocity, very quick movements to allow the vertebrae, the spinal bones, to align themselves, decreasing the pressure the irritation or the stretch over the nerve, subsequently allowing it to normalize itself. It has to be very specific. It has to be accurate. And by the way, it is very, very safe. So I want you to understand that. We're going to talk a little bit more about that type of thing. We're going to talk about structural care and athletes, whether you're a weekend warrior or not, but we're going to get into all of that today. But I want to take your phone calls at 888-630-9625. That's 888-630-9625 on any question that you have that relates to your problems, your health. Karen, how can I help you?
Good afternoon, Dr. Roselle.
Good afternoon,
Karen. My husband has shingles.
I'm sorry.
Yeah, he's had it probably for about a month, and he's gone to the doctor, and they got medication. And he's a former Marine, so you know how they are.
Yeah, I've been there.
They ignore all the rules now.
Yeah, pretty much.
But he goes. And his real problem is sleeping at night.
Karen, where's the shingles? Where did it manifest?
It's on his back and his side.
Okay.
Now what do you call them? It's scabby now. You know, it's not in the beginning stages.
No, it's going to be that. The pain pattern, though, with shingles can last a long time, and it can sit there. I mean, it starts looking like these little vesicles that begin to rupture, and then it looks like herpes. If anybody's had a genital herpes, it looks like that. If you've ever had chickenpox in the early stages, it looks like that because it's the same virus. And it follows a nerve route and follows a nerve track. It starts in, at the spinal level, and it moves out into the neurological area. The medical treatment generally is they're going to put him on steroids, and or they're going to put him.
The doctor put him on an antiviral for a week.
Did it
I
help?
don't know what the name of it was, but it was 3 capsules 3 times a day, and they were 1,000 milligrams each.
Okay, how did it help him?
Well, you know what it did? It kept him from doing anything.
Yeah, of course.
Which was probably good because he'd be out mowing the lawn. It made him dizzy. I had to drive, but he said that he keeps busy during the day because it distracts him from the pain.
It does.
And at night is when he has trouble. And I would say that he sleeps every other night.
Well, it's not a good thing. So let me tell you, what his options are and what we see all the time in practice and so forth. I mean, obviously it can be extremely, one, it can scar if it gets out of hand. 2, is extremely painful. The antiviral drugs are significant in that they decrease. They usually use steroids as well, in addition to antivirals. Zovirax is one, that is the most common, and guys just kind of write that like a prescription. But the point of it is that the herpetic virus is there all the time. The shingles virus is, basically the same type of thing. And if you've had chickenpox, you've got the virus in your body. And, all this stuff now, they're going to do shingle vaccines and so forth. All they're doing is they're taking the virus that you already have, because they're saying that you're more susceptible if you've already had chickenpox. And now you have a weakened immune system, so it triggers the reaction, and you actually can get the problem from the shingles vaccine. So Cyclovir, which is Zovirax, by the way, and Famvir, if I remember it and pronounce it correctly, and Valtrex are usually the 3 that are the most commonly used. But they try to dampen the longevity of this thing, and but they'll use steroids, they'll use prednisone. So let me tell you what our experience is with this thing, and the sooner that you can get a hold of it, the better. The combination of things that are nutritional antivirals and acupuncture and low-energy light laser are extraordinarily effective, and they can break down the pattern quickly. Vitamin B1 thiamine, 100 milligrams generally taken every hour for 10 hours a day, 1,000 milligrams, will help decrease the neurological sensitivity. L-lysine, lysine is amino acid, generally 1,000 milligrams 4 to 5 times a day. There are other antivirals that work very, very well in addition to that. We test them. It depends on the patient's history, depends on how they're presenting, how you would go after this. Things that you want to avoid, anything that is an arginine type of food. What's an arginine type of food? An example is peanuts and peanut butter. So you don't you want to get that person off of those things. Go to almond butter. The arginine in that will exacerbate the problem. It actually will set it up for it. Peanuts, what people have to remember, are not nuts. They're a fungus. Now, hang on for a second, Karen. I've got to take a break, and we'll be right back after this message, okay?
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. Yep, I'm in studio. I'd love to take your phone calls. 888-630-9625. That's 888-630-9625. If you'd like to get a hold of us outside the program, it's really easy. All you have to do is go to rosellecare.com. That's ROSELLECARE.com, which is connected, by the way, to another website called drtomroselle.com. That's DRTOMROSELLE.com. And by the way, there's all kinds of presentations, there's webinars, there's things that you'll enjoy to learn. So go there, rosellecare.com. If you'd like to talk to one of my doctors and get some information one-on-one, call the office, 703-698-7117, 703-698-7117. In the news recently, I'm going to get to our phone calls in about 30 seconds here. I just wanted to let you know because I've had a couple of patients ask me, and I guess as soon as something comes out, they want to know about it. So school just started, and kids are grabbing their backpacks, and whether it's elementary school, whether it's high school, or whether it's college, and in the world today, in the work world, people are wearing backpacks and throwing all their stuff in there. So the question becomes, what backpack would I recommend? Well, it has to do with not just style and looking good, but it has to do with how it fits the spine and how it supports you so it doesn't break your shoulders or your back down. I often push away from recommending any one product. But in this situation, and besides the fact that the American Chiropractic Association also endorsed it, the North Face's Recon backpack is really the best out there. It fits properly, it's safe, it does a great job, it feels good, it doesn't seem to aggravate already existing situations. It has a thickly padded air mesh. And by the way, nobody is paying for this kind of mini ad right now, but I want you to know that you need to take care of your spine, and this is one of the ways that you can do that without any problems at all. Let's go to the phones. Laura, thank you for waiting. How can I help you?
Hey, Dr. Tom Roselle. Thanks for taking my call. And I'm calling for a friend that has started experiencing numbness in the palm of her right hand. She has arthritis in her fingers of that hand, and all of a sudden she felt like there's numbness. It started like a week ago, and it extends to the foot. She can't lift her foot from the ground and walk like she used to.
So Laura, it's all on one side of the body, correct?
Yes, one side of the body, and she feels like she's going to fall on the right side.
Okay, so if it's on one side of the body, it's usually coming from the spine, and if it's affecting the hand and the leg or the foot on the same side, it's probably coming from the neck or higher up with the position of the skull on the first and second vertebrae. Now, remember, the spinal cord is this long communication network from the brain all the way down, and it runs everything. It makes you feel things. It makes you able to work and do and grasp and so forth. So if you visualize a telephone cable, and they have fiber optics, all these little fiber bands inside of it. Spinal cord is a lot like that, And if you put any pressure on any one of these fibers that go down the cord, depends on where that fiber goes, will determine the type of symptom that you will have. So my guess, without knowing her, is the fact that there's probably some movement, some misalignment that is either new or one that has been progressive over a period of time, causing spurs or little beaking formations and so forth within the body, and there's pressure on the nerve roots. It can be treated, but it has to be diagnosed properly. But when you have multiple findings on one side of the body, it's usually coming from someplace along the neurological network, and that's where you look first.
Yeah, so, and she has a herniated disc as well.
There you go. That's what I'm talking about. Yeah. So we find that, but it can be treated, and it can be treated very effectively and very safely. Laura, have your friend.
Who does she go to?
She goes to somebody like me.
Like you.
That's right. Give us a call because
unfortunately she doesn't have any income that makes her pay out of pocket.
The thing of it is, Laura, is that if she's on Medicare, she does have some coverage for the work that we do. So give our office a call, and you can find out specifically what's going on and what kind of coverage she has. And
yeah, she would like to come, but she called, I think, and asked, and one of your employees told her, no, you have to pay out of pocket $350 for first, and she can't.
Well, the examination fee is not covered, but that's one of those things. But if she's interested, have her call our case manager at the office, and we'll handle that from there. Laura, thank you very much for your phone call. Susie, how can I help you?
My hubby had a bone spur removed from his heel a year ago, and now the problem has recurred. And the bone spur seems to be on the top of his foot, but he's having pain on the top and the bottom of his foot.
Yeah, so let's walk through that a little bit. A bone spur is nothing more than an end product of something else that's not working the way it's supposed to. That's why he got it back, because the original problem wasn't taken care of. So when you look at the legs or the feet or the arms or the hands, you have to remember that we have this whole leveraged engineering mechanical apparatus that starts with the electrical system called the nerves from the spine, and they go down on the legs. Now, the muscles that allow the foot to move forward, to spring off your toes, to walk forward, to lift your toes up, all come from the lower portion of the back. I mean, as far as the innervation is concerned, but the muscles come from the leg, and they extend into the foot. And if the muscles are weak, then the bony mechanism of the foot, the heel, which is called the calcaneal bone, the next bone in called the talus, and so forth, are dependent on the support mechanisms both of the ligaments and the tendons that hold them tight, but also on the muscles that make them move. So you have to find out which ones are doing that. Now, the acuteness, the right now situation of the pain that's involved there has to do with the mechanical position of that foot. So there's lots of things that can be done to get rid of the symptoms or support the symptoms, from everything from orthotics to exercises to ultrasound to acupuncture and so forth. But what you have to do is you have to balance the foot. You have to go as far up into the train, if you will, as you can. If it's the foot, then you check the calf and the knee, and then you go above that into the thigh muscles and the hamstrings. Then you go to the hip, and then you go to the spine, and see where it's coming from. In our experience, believe it or not, one of the things that I find is that the first vertebrae in the neck, the cervical 1 vertebrae, when it moves forward out of position in mass, causes a recurring tendonitis in the foot, in the heel, and then the foot drops, and then you have other things that associate. So you get somebody who's had a car accident maybe 15 years ago, 10 years ago, 5 years ago. All of a sudden they start developing what we call pedal-based problems, foot problems, ankle problems.
Wow.
And it comes from that far up. So if you fix that and then you fix the symptoms, then now you got a problem that is stable. It goes away.
Because he had C6 and C7 fused.
There you go. And that's going to affect the mechanics further up as well, so it's going to push that first vertebrae forward. Years ago, Susie, I had, and you've heard me probably talk about it on the radio, I've had 2 major accidents over the last, I think, 11 years now, and both of them should have killed me. Subsequently, my spinal system, my neck and my low back, have multiple levels of degenerative disease. If you went to a radiologist or a neurologist, as a matter of fact, I've had 3 neurosurgeons say they want to fuse my spine. I said, no, it's not happening. And what we've done is, and I'm fully functional. Those of you know me, I can do what I want to do. And I have full mechanical function in my body, I'm not in pain, it's because of I do what I tell everybody else to do. So in this situation when you have bone spurs, you have to ask the question, why is that? And then fix the why is that, and then the symptom, the foot problem, begins to go away. So, Susie, if we can be of help in any way, please let us know, because it's something that really, really can be done. Brent, how can I help you, sir?
Michael, I'm just interested in your thoughts on daily supplementation of vitamin B complex.
Not everybody needs the same things.
And I'll hang up and listen.
Oh, okay. All right. Didn't want to talk to me. I wanted to talk to you. So here's the deal with B complex. You need it for neurological function, you need it for hormonal function, you need it for fat metabolism, and the list really goes on. But it depends on what your stress level is, because stress is the number one thing that burns up B complexes like it's going out of style. I mean, it's like, give it the fuel that it needs so it can continue to stress itself. But no, here, seriously, all kidding aside, you get B complexes, vitamin B, from a lot of different sources, and it's best always to get it from diet. It's best always to modify the stress pattern as best you can. Yoga, Tai Chi. I mean, my life is crazy. I'm always on the road. I'm always doing all kinds of things. I take a B complex on a regular basis, but like anything else, there is no one supplement that is taken forever, always, without discontinuing, without rechecking it to see if it's appropriate or if it's supportive continually to the body. So you have to make sure that your body has the capacity to heal. Number one, find out what the problem is. Is it a B complex problem? So now that I've told you all the yes and no's, and actually we could talk about B complex the rest of the program, but here's the deal. Food first, okay? You get it from diet. Secondly, you want to look at the type of B complex. Low dosage is always better than high dosage, and a full B complex at low dosage is best. When you take one B and you don't take the rest of them, and you do that for a long period of time, you off balance, you upset the relationship between that vitamin and other vitamins in the body. So they have to be done in harmony and balance. Always get an organic form. Do not get something that's synthetic, because it'll cause other forms of damage in your body. Go to places like Whole Foods or Mom's or Trader Joe's and ask the person that's in charge of the nutrition department for a low dosage B complex. B complex is one of those things. If you take it and you feel good, it's probably good for you. If you take it and you don't feel good, it's probably something that your body doesn't need or you're allergic to, because if it's derived from good food sources, you can be allergic to it simply because you're allergic to the stuff that's derived from. So anyway, Robert, I hope that helps you. If I can be of further assistance, just get a hold of me at rosellecare.com. Send me a note. Happy to talk to you on that or anything else. 888-630-9625. There was an interesting notice, and I've met this incredible officer. Her name is Brigadier General Halstead, and she was presented with a leadership award because of her participation at the New York College of Chiropractic. And this woman is a West Point graduate, and she is the first one to ever receive the rank of general, and basically, let me clear that up. She was the first female graduate of West Point ever to be awarded that high level of military achievement. And, I'd like to salute her as an old ex-Marine and, really let you know that chiropractic care and acupuncture and nutritional care and so forth is becoming far more effective and involved in the military today, as it should be, because it's cost effective. It gets people back. Remember when I had Dr. Zadkoy on here about, I think it was 2-3 months ago, and Dr. Stephen was talking about the problems that, our military coming back with emotional and anxiety-ridden conditions, and he was able to handle those things, and he has a grant from the military to study that. So we're seeing more and more of this, and I want to encourage you to, check it out. I mean, do your homework. Look up, Brigadier General Halstead and see what she's doing, because I think you're going to be very, very impressed on the effectiveness of some of the things that are there. 888-630-9625. We'll get back to your calls in a second and try to put a little bit more sunshine on your health, if you will. Just remember, those of you who read my book, Health is a Do-It-Yourself Program, Ageless Health, Health is a Do-It-Yourself Program. I wrote it simply because that you have to be in control. That if you leave it to somebody else, you got a problem. You go into a doc for pain, and they give you what? They give you a drug. They give you a painkiller. Here's the statistics, my friends. 17,000 people die directly from the wrong prescriptions every year when it comes to pain medication. 40,000 people die because of the combination of aspirin and prescription painkillers every year in this country. So when you take that into consideration, we truly have an epidemic of failure in our healthcare system relative to how do we treat things effectively. Sometimes it's just prescription arthritis. And what I mean by that is you go into a doctor and he writes on a prescription pad and he just takes this, right? Well, 80% of chronic conditions are lifestyle related. You change lifestyle, you get rid of the poor health underlying it, you get the body to work mechanically the way it's supposed to, and guess what happens? Things turn around. Your body will change effectively, rapidly, and in many cases, miraculously. We're going to talk more about that. And remember, RoselleCare.com is how you send me a note or one of my doctors so we can talk to you directly and we can really answer your questions. We're there. We're available. We're coming up to a break. Don't go away. There's a couple more you hanging on the line. I'm going to try to get to you before the program's over. But we do this program for you every Sunday, 12 o'clock. Don't forget to tell your friends. I'll be right back.
This is Dr. Tom Roselle, author of Ageless Health, Health is a Do-It-Yourself Program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself Program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
WMAL-FM Woodbridge, Washington, WMAL Washington, WRQX HD2, where Washington comes to talk.
Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle Live. We're here at 888-630-9625. And to find us after the show and to get your information answered specifically and directly, just go to rosellecare.com. That's ROSELLECARE.com. Send me a note. We will answer you, I promise. And by the way, if it takes a little longer than 24 to 72 hours, you can always call the office at 703-698-7117 and tell my staff that you'd like to talk to one of our docs and say, hey, I need to have something answered now, not later, now. Robert, how can I help you, sir? Robert.
Oh, yes, doctor, yes. Thank you for taking my call.
Not a problem. How can I help you?
Listen, I took care of my 94-year-old mother myself, and I'm a believer of what you said. We're in charge of our own health. A year ago, she got a stroke in October, and she had to have a G-tube. She went to a skilled facility for about 2 months, and she was on the pump. She went to another facility. It wasn't skilled because she stabilized for a day, not even a day, and they changed it to the bolus method. She went in the evening. The next day at 2 o'clock, she vomited. She threw up her food, and that evening she went to the hospital. She aspirated, and she died. I looked up the American Gastrological Association did a study 20 years ago and said the bolus method was a high-risk method.
It is. It's very high risk.
Well, why did they put her on that?
Because they felt that she had some ability to swallow, and some peristalsis would occur, and it's easier and less costly than putting in a G-tube.
Well, she couldn't swallow.
No, but they made the determination. The only time that they use the bolus method, is if there is any peristaltic action at all, that they can put the food in the mouth and they can get.
Well, let me ask you this: she got pancreatitis. So when she threw up the method, she went to a very prestigious hospital. They used the same method, and the doctor said she probably threw up because of the infection. Now, pancreatitis, I believe that the bolus method was she was 94 years old. It was too much for the system, and that's how she developed the pancreatitis.
I agree. I mean, the pancreatitis is going to come about because of an inflammatory reaction of the pancreatic area, and anything that it can't digest or break down. Remember, the pancreas does a lot of things, but in digestion it helps break up fat, and it also helps break up the outer layer around vegetables. Okay,
right.
And in digesting the bolus, so our listeners know what we're talking about, is a food ball. And when they use the bolus method in feeding, it's a pre-digested food. And they're, animals do it with their young. They chew up the food and they put it into the animal's mouth, and it's easier for them to handle. But other than someone who has the capacity to do that, and they want to get the saliva and so forth, because the truth of it is that anybody that has a G-tube is going to ultimately die of starvation because the first stage of digestion has been bypassed, and you're going to get more breakdown, cachexia, and so forth as time goes on. Robert, listen, I'm coming up to a break. What I would like you to do, I'd love to talk to you about this even further.
I appreciate it, because I took care of my mom, and it just didn't. I don't want to find fault with anyone.
Listen, I get
it. Better.
I totally get it.
The doctor told me, he said, Mr. Padula.
Robert, I've got a break. So
okay, sure.
Get a hold of me at rosellecare.com. And let's go back and forth, and I'll help you do it. But a G-tube is used for survival methods. It's for patients like Alzheimer's patients who've forgotten how to swallow, people who have esophageal problems, people who have chronic irritation of the bowel, Crohn's disease, and so forth. Where should we get into it further? We'll see you next week, same time, same place. This is Dr. Tom Roselle.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.